I would like to request Abdullah Khalil from Warsak Model School and College, Peshawar, to deliver his speech.
Assalamu alaikum. My name is Abdullah Khalil and I'm a student of grade 9 from Warsak Model School and College, Peshawar. And today my topic is about healthy beginnings, hopeful future. Today on World Health Day, we gather to discuss a truth we cannot ignore. Every mother and the newborns deserve the rights to survive, thrive and dream. Yet millions of lives are lost each year due to gaps in maternal and newborn care. But these gaps are not just statistics. They represent mothers, babies, and the future that our world is failing to protect. Did you know the World Health Organization reports that over 800 women die daily from preventable pregnancy related causes? Even heartbreaking 2.4 million newborns perish within their first month of life due to lack of basic care. But these deaths are not inevitable. In Pakistan, the situation is more miserable, especially in rural areas. They occur because of unequal access to healthcare, poverty, and societal neglects of women's long-term and well-being. When a mother dies, families shatter, communities weaken, and hope dims. We must prioritize women's health beyond childbirth, ensuring mental health support, nutrition, and lifelong care. Respected audience, progress begins with effective investments. Imagine a world where every mother has access to prenatal checkup, skilled birth attendance, and personal care. Simple solution like this could prevent 75% of maternal death. Government and leaders must fund clinics, train healthcare workers, and provide affordable maternal services. But this isn't just about money, it's about valuing women's life. Investing in maternal health yields stronger economies, brighter future, and healthier families. Respected audience, a collective action where every individual has a role is the need of the hour. Changes are required from all of us. Government must enact policies, NGOs can bridge gaps in rural areas, and communities must support mothers with empathy. But what can we do as students? Raise our voice, volunteer at local health centers, donate hygiene kits, or simply educate families about prenatal care. Let's also honor midwives, healthcare workers, and doctors and nurses who brave challenges to save life. They need better pay, resources, and our gratitude. Respected audience, to parents and future parents here are some suggestions which everyone must follow. Attend every checkup, take prescribed vitamins, and monitor their pressure. In childbirth, seek skilled professionals. Never delay any care if there's bleeding, fever, or prolonged labor. Watch for the warning signs like severe headache or breathing difficulties in babies. In childbirth, breastfeeding within the first hour creates immunity, and kangaroo mother care, skin to skin contact save preterm infants. At the end, I would add healthy beginnings are the foundation of hopeful futures. Let's turn awareness into action, indifference into investments, and silence into solidarity. Together, we can ensure no mothers fail childbirth, no child life is cut short, and no family grieves a loss that could have been prevented. Let's pledge today healthy families, healthy mothers, healthy babies, and a healthier future for all us. Thank you.